The home care providers industry is one of the fastest growing healthcare segments in North America today, and Leap Health finds itself in the midst of this boom. Let's welcome the President and CEO of Leap Health, Chris Dobbin. Chris, thank you so much for joining us today.
Thank you for having me.
So we know that Leap Health is in a determined expansion mode, and you've recently extended your portfolio of companies. Tell us about that.
We have been acquiring at a fairly rapid pace. We're obviously in the home care services-based business. Our target has been primarily within the New England area. And so we closed a deal or an acquisition in Rhode Island last September, went into Vermont in October, followed that up with 2 acquisitions in Massachusetts, one in February this year, another in April, and then actually made our first acquisition in Canada with a Halifax-based company that we closed in June. And we've just most recently announced 2 more acquisitions. Both are within the New England area and fit nicely with the operations that we currently have there.
So why does this particular growth model, this business model, work for Leap Health and this sector particularly?
The number one, demographics are driving a fairly large opportunity, and I think most people would understand that for the next 50 years or so, the demand for home care services will increase, and so there's a business opportunity there to provide, I think, some skilled services to the folks that need them within their home. There's sort of 2 things I believe that will hold true, and were part of the reasons for doing this. One, I didn't ever believe we would run out of clients. I thought the demand would exist for the next several decades. And 2, that the opportunities for us to both expand organically or to acquire would also be there. And those 2 things have sort of held true over the past year to year and a half.
Also, would you agree that demographically there are many factors that are driving growth in this sector, given that chronic care is so challenging and there are rising incomes and people are more willing to take private home care?
Right, so our business is primarily a private pay type of model. And so I differentiate that from a government-sponsored type model that you would normally see in, say, a Medicare or Medicaid-based model in the U.S. So I'd say roughly 80% of our business would be pure private pay, so paid out of pocket by those we provide service to or their adult children. The other 20% would be a mix of Department of Veteran Affairs, so veterans we support within our home, or commercial insurance, such as long-term care insurance providers. So that would be the mix of payers that we would deal with in our industry at the moment.
You continue to set these amazing goals in terms of your revenue estimates each year, and you continue to beat them. How do you plan to close 2018?
Yeah, I do think it's important that we give the market some sense of where we're going, and we've done that. I believe we began to do that last November in 2017. And so at that time, we told the market that we expected to exit 2018 with at least a $10 million US annualized revenue run rate, and we exceeded that on our, in June. You would have seen our Q2 results for June that we were at $11.4 million US. We then told the market that we expected to finish between $14 to $15 million US as an annualized revenue run rate. And with the 2 acquisitions that we just announced in New England, that will obviously put us over that target. So it's good, I think, when the management team can outperform the targets they put out to the market.
And Chris, what will bring long-term growth at Leap Health?
I think there's 3 ways that we look at long-term growth. One, we will continue to focus very much on organic growth, and one of the strategies we have is opening brand new office locations, geographical locations, and so that will become more and more prevalent as we expand. We'll continue to make acquisitions. I mean, we continue to have a number of acquisitions in front of us. Every time we announce an acquisition, we tend to be contacted with new opportunities because they see that Leap is a good buyer, which is great for us. And really the third area is partnering potentially with private hospitals in the U.S. It's a little bit more difficult to do that in Canada, but in the U.S., where the hospitals tend to be owned by private equity firms or individuals, there's a bit of a more entrepreneurial spirit in the U.S. where they're almost incentivized to partner with home care agencies that we would have because of the way that they're rated through the Center for Medicare and Medicaid Services. So there are some opportunities there that we're exploring, and that would be the third avenue that I would see as sort of a strategy for us to grow.
Chris, it's been a pleasure speaking to you. Thank you so much for your time.
Thanks for having me. I appreciate it.